Hey everyone, welcome again to another awesome webinar we have for you today. We have Dr. Andrew Campbell with us, and he's going to go over uh, uh, vaccinations and different things like that with us today. So yeah, if you have any questions, go ahead and throw them in the chat and we'll try and get them answered as we go. But I'm excited for this one. So go ahead with no further ado. Dr. Campbell, take it away.
Hello, everyone. So just to let you know, I'm the editor-in-chief of several medical journals. I lecture at several universities in the United States as well as abroad at Oxford University in the UK. I have published over 100 studies, including a study on vaccines. And so that's who I am, which is not that important. Just to let you know, this came out in Scientific American, the next deadly plague. So get ready. So I'm going to take you through a bit of a trip here. People have these chronic problems, chronic health problems. And as a result, these are the 3 steps. This is my first slide. When I lecture at medical schools, I don't lecture students, I lecture faculty. This is what I teach the faculty. So when you've got a chronic medical problem, instead of ordering a bunch of tests and everything else, first detect the cause, remove the cause, and then repair the damage, and the patient is cured. And as you can see by the color of my hair, I've been doing this for quite a while. I want you to watch this.
In 160 seconds, you will decide how the story ends. This is a story about us, the indoor generation. A generation that spends 90% of its life indoors. It all started the day we left nature behind. We filled our homes with lovely things and all the stuff we wanted. Our homes became places you would never want to leave. Artificial light replaced daylight. And we built our houses so that nothing could escape. We cooked and showered, breathed and played, slept and sweated. But we had closed ourselves in, to a point where nothing could get out. So when the air turned bad inside, we tried fixing it with chemicals. I put in little artificial suns everywhere to make the darkness bearable. That's when things started to happen. Hard to notice in the beginning. Some needed help to sleep, to breathe, to not itch. Many of us even started to feel sad. So we turned on happy lamps to make the sadness go away. Then, scientists discovered that the air inside our homes is up to 5 times more polluted than the air outside. And that the lack of daylight can affect children's learning and increase blood pressure. It turns out that kids' rooms often have the highest concentration of toxicants in the house. In fact, millions of homes are unhealthy to live in. They discovered that living in damp and moldy homes increases the risk of asthma by 40%. And I learned that millions of people like me suffer from asthma and allergies caused by a bad indoor environment. And so, here we are. How the story ends is up to you, because it's not written yet. If you care about the indoor generation, do something. Begin to think and live differently. Let light and fresh air into your life. Even small changes can make a huge difference for coming generations. Learn how at theindoorgeneration.com.
So we learn about what we breathe. So now we have this issue of climate change, molds. And because of molds, we have mycotoxins. Molds are the gun, mycotoxins are the bullet. A lot of places in the world that you hear about this all the time on the news about unexpected weather, flooding, hurricanes, etc., disasters, damage, and of course, this brings mold-infested homes, schools, businesses, public buildings. That's all according to the World Health Organization. Here's an example of mold in existing structures behind walls where you can't see it, or underneath wallpaper. And here is mold construction. There's new construction, and you can see the mold growing. This is old. This is from the 1980s, almost 40 years ago. Spores of toxic molds or fungi contain mycotoxins, and they're likely to be absorbed by the respiratory epithelium, that's lining of your lungs. And then from there, it's transported other sites in the body, producing health issues. Okay, so having said that, size is an issue. Here is 100 microns thick. Mold spores are 2 to 4 microns. So they go to the deepest part of your lungs and the deepest part of your sinuses. And mycotoxins are 0.1 microns, the same size as a COVID virus. Have you all heard of COVID? Yes, of course. So where do mycotoxins first affect the body? They first go to the brain and nervous tissues. And what do they do? I'm sorry. What do they do in the brain? They bind to human tissue, including brain tissue, such as myelin, and they trigger what is called demyelination. So what does that mean? Increases in autism spectrum disorder. This is all from medical evidence. This is not my opinion. This is all from medical studies from various medical institutions. Decrease in short-term memory and long-term memory in adults and children, optic neuritis, you get blurred vision, problems with eyes, chronic inflammatory demyelinating polyneuropathy, Guillain-Barré syndrome, ALS, which is Lou Gehrig's disease, and Alzheimer, multiple sclerosis, movement disorders, Parkinson's. But let me take you so you can actually see the studies. And this is infected, different brain regions are infected with fungi in Alzheimer's disease, okay? So you can see that they did autopsy, they looked at the brain, every part of the brain, including blood vessels and the cerebrospinal fluid had fungi. Here's a different study, and here's where they find compelling evidence, fungal infection in amyotrophic lateral sclerosis, Lou Gehrig's disease. Another study out of University of North Carolina showed that 5 to 10% of Lou Gehrig's disease is caused by genetics. The 90 other percent is caused by molds, toxic molds. So it also causes postural tachycardia syndrome, chronic fatigue syndrome, fibromyalgia, autoimmune disorders, and dysautonomia. This is all from these studies that are always on the bottom. And they affect testosterone. They lower testosterone in men. They affect estrogen because certain mycotoxins, such as zearalenone, are mycoestrogens, meaning they confuse the body, and the women have excessive bleeding, abnormal menstrual cycles, etc. And then they also cause what is Hashimoto's thyroiditis. And millions of people struggle with Hashimoto's. They eat normal amounts of food, exercise regularly, yet they keep gaining weight. And their thyroid levels are difficult to treat. So this is because the cause are mycotoxins, not the thyroid. So you treat the cause, Remember that slide. Find the cause, remove the cause, repair the damage. Once the treatment for the mycotoxins is complete, the Hashimoto's go away. Here's that study that showed that. So what about other chronic illnesses and autoimmunity in particular? Okay, so they affect the function of the central nervous system, which is the brain, and peripheral nervous system, which is all the nerves in your arms and legs, but also the glands of internal secretion like the thyroid, pancreas, adrenals, and they can cause the development of autoimmune thyroid disease and diabetes. What about breast implants? What do you think this is in a breast implant that was removed from a patient? That's molds. Molds get in during the manufacturing process. A group of doctors and I have published 23 studies on the effect of breast implants in humans, and I can tell you they have molds. That's been known since the 1990s. Let's go a little bit. This is about SIBO, the gut. Okay, here is before treatment, 3 months later after treatment. This is a young woman who wrote this herself. Okay, and here are rheumatoid arthritis, an autoimmune disease. There's 2 mycotoxins that can affect rheumatoid arthritis. And here's the study that shows that. Now, here is a patient of mine. You can see from his arm, right arm here, and look at his ring finger. That's rheumatoid arthritis in his finger. I'm sorry. And on the bottom, his arm, that's psoriasis. Same thing on the right side. That's his abdomen and chest. You can see the finger. This is psoriatic arthritis. This is after 6 months of treatment for mycotoxins. This is the mother of a well-known doctor who lectures at major medical conferences. She's 63 years old. He asked me if I could treat his mom. That's psoriatic arthritis. She took this picture with her phone, with her iPhone. You can see before on the left and after on the right. I like to take pictures because I think that says a lot. What about multiple sclerosis? Multiple sclerosis, gliotoxin is the mycotoxin. And this is a study, you can read it at the bottom. It's a major mycotoxin that causes MS. And when you have this mycotoxin, do not use glutathione because it increases the levels of gliotoxin and its toxicity. And here's from Rutgers University. Here's another study that I did with a doctor from the Washington University School of Medicine and others. Rutgers, 210, that's 14 years ago. We propose that fungal toxins are the underlying cause of multiple sclerosis. I have treated many patients who come to me in wheelchairs, and a year later, they're playing volleyball. So this, I'm not boasting. This is in published medical studies from important medical institutions. And the variability, this is, what about urine testing? It says that if you really want to do urine testing, you have to sample it at different times during the day. And because the test is based on creatinine levels, that is affected by a number of factors such as gender, age, diet, and muscle mass, and can influence creatinine secretion. This was published in a journal a year and a half ago called Toxins. Now, what else did they? Here's the best thing. Here's the most precise and accurate test for mycotoxins for Mycolab. It measures 14 different mycotoxins. So let me look a little more. So here's that. This study also said that the blood serum testing detects mycotoxins in human serum comes with significant accuracy, precision, and specificity. I've been using this test for 30 years. It is very accurate. That's what I want to know. I don't want to know what's left my patients, what's been excreted. I want to know what's in them. So here's a urine test. Notice at the top left, it says metabolite. So it's not a test on the mycotoxin. It's a test on the metabolite. What does that mean? It means if you go out and have lunch, and in that lunch you eat some asparagus, your urine is going to smell of asparagus the rest of that day. Well, that's the metabolite. Okay. Other tests that lack medical evidence besides the urine, the oat test in urine for molds. Forget about that. HLA-DR genetic testing. There's a group that says this affects 25% of Americans. Well, that would mean that about 82 million Americans have this genetic defect, yet there's not a single published study, and it's not taught anywhere except for this group of Shoemaker and Neil Nathan people. However, let's take another disease that's 50 million people less, not 82 million, 32 million. You know what that disease is? It's called diabetes. And everybody knows about diabetes and has heard of it. The visual contrast sensitivity test is just bunk. Don't do it. Don't waste your money. The MSH, C3A, C4A, don't worry about those. Don't use them. Now, people have tests for stools. So here's a study. It's a research article published. They looked at this GI map test, and look what the result was on the top, on the bottom right-hand side. It was only 26% accurate. Specific. I'm sorry, not accurate. Specific. What does that mean? It means 74% is not specific. Don't use that test. There's a lot of docs that don't read, like I do, medical journals. Here's another study that there's a lot of this organic acid test, OAT test. They claim to detect imbalances in the gut bacteria, fungi, but these don't measure what they say they are measuring. And many labs focus on the level of chemicals in urine. I'm so sorry. Why are you measuring something that's left the body? You need to know what is in the body of your patient. So you should measure the immune response. And that way you can really know what you're dealing with in your patient. So this is from a slide given to me by Dr. Ari Vajdani, who has immuno laboratories in Los Angeles, immunosciences. So look at for body burden, not chemicals coming out of the urine. How do you treat this? Itraconazole. If you go to Dr. Google, it's going to say it's going to fry your liver, your teeth are going to fall out, and all kinds of problems. No, it's been well tolerated. This is what it says in medical evidence. It's well tolerated and generally free of adverse side effects. Let me take it a step further. Here's another study. It was developed in the 1980s and has an established safety record. Let me show you one more thing. This has to do with cancer, because itraconazole, which kills molds and mold spores, and therefore the mycotoxins, is being now used in cancer. On the left two pictures, you see this cancer on a forehead. You can see that it's pretty advanced. 59 days later, where is the cancer? That is effective treatment. Less than 2 months. By the way, don't get taken in by all these practitioners who give you all kinds of antifungals. Fluconazole only treats yeasts, single cell molds. Itraconazole treats single cell and multiple cell molds, as you can see on this chart. That includes Aspergillus, Stachybotrys, Penicillium, etc. So don't fall for these binders. Here's a study that was published 5 years ago. Okay. They looked at all these binders, kaolinite, clays, activated charcoals, zeolite, bentonite, etc. And they're effective in neutralizing aflatoxins, but aflatoxins don't grow in indoor spaces. They grow outdoors. They're ineffective in all other mycotoxins. On top of that, they bind vital vitamins as well as macro and micro elements. So, are you taking a bunch of supplements to try and help yourself? I understand. You think they'll help you. This is a study from November 2023, 8 months ago. They took 60 common supplements and took them to the laboratory. 11% had in the bottle what is on the label. 40% had nothing in the bottle that was on the label. So this is why people don't feel well and get ultra sensitive and then try more and more supplements and they don't do well. And I know I've been doing this for a long time. So here's a study that came out last year. Increased death from fungal infections during the coronavirus disease 2019 pandemic. So people died from the fungal mold. And what about treatment with itraconazole for long COVID? Okay, here's 2 studies. The second one is proof of concept, giving long COVID. What is the theory behind this? How did this all come about? Because people stayed at home. They didn't go out anywhere during the pandemic, and their homes had mold. They got sick and they had COVID, but they were already sick with molds and mycotoxins. So this is what these 2 studies show. And here's this study. Of course, coronavirus presents a serious public health problem worldwide. So it's important to find an effective treatment. This study showed that the possible role of itraconazole as a new therapeutic option. And then what about chronic pulmonary aspergillosis, which is a mold, during convalescence from severe COVID-19 treated with itraconazole? They're saying it worked, and not only that, they should test for that. Now, as far as your home or wherever is concerned, on the internet, all these sites which base themselves on making money say, do the ERMI test. This is, folks, this is going to be 11 years old. Public may be making indoor cleanup decision based on EPA tool developed only for research applications. Don't use the ERMI test. It's not the test to use. I want to leave you with a couple of patient comments. I've watched all your videos, and if you go to the internet, go to YouTube, go to my Mycolab's channel. I have 68 webinars on all kinds of health problems. Watched all your videos and etc. So here was seeing the functional medicine. I've not progressed in 3 years. If you use the other paradigm for treatment, it's 6 months, not 3 years. They didn't make progress in 3 years. Here's another one. Past 12 months, I've been sharing the My Mycolab website with all my mold remediation clients and recommending they take the My Mycolab test. I've learned so much from Dr. Campbell, and I so appreciate the education and providing a real solution. I think it's finally having an impact with all the so-called mold doctors who follow Shoemaker's useless binder protocol. I see many doctors, including Dr. Tom O'Brien and Jack Wilson, now discussing mold more and more. I think Shoemaker has single-handedly held up the health of many millions of people around the world. Dr. Campbell is unraveling the damage Shoemaker and his followers have caused. And Here's from a health coach,
I didn't get that.
etc.
Could you show
So
me?
as a result,
I didn't get that.
etc.
Could you show
So
me?
as a result, people are finally getting well. And lastly, if you want more information, send me an email, immunedoctor@gmail.com. If you want the mold questionnaire, I'll be happy to send it to you. If you want information, I can send that to you. It has more than 160 references. Here's 2 publications. One is Molds, Mycotoxins, the Brain, the Gut, and Misconceptions. The other is a big misconception about Lyme, too. There's a lot of stuff that's out there on the internet that's crazy. Lyme disease and mycotoxins, how to differentiate between the two. These 2 and many others are published in medical journals. So, any questions?
Is there any questions anybody has you want to throw in the chat? And we can bring those up to Dr. Campbell. Here we go. All right, we got a few. It says, I have idiopathic peripheral neuropathy and is questioning if the intraconsole would benefit them.
Yes, idiopathic means the idiot couldn't figure out what it was caused by. Okay. A group of doctors and I published a study and its chapter in a medical textbook in 2004, 20 years ago, on this subject and how to diagnose it, how to treat it. So it's not like something that just happened. Yes, this has been known for, if you are a doctor and read what you should read, these are well-known things in medicine. So it's not idiopathic.
So you would recommend that the intraconsole, is that how you pronounce it?
Yes.
Okay. We got another question. So you said don't do the ERMI, the ERMI testing. What test would you recommend for the living space?
I recommend that you go to My Mycolab's YouTube channel. There's 2 webinars I did with an inspector, a mold inspector who has several diplomas, and real diplomas, not these weekend at a Holiday Inn Express place, and gives the pros and cons for every different test. And just watch those 2 webinars. It'll give you a bunch of information about how to look for it, what tests are good, what aren't so good. What, if you get an inspector, what are the questions you should ask them? All those things are in those 2 webinars.
Okay, cool. Got some, oh, we got somebody dropped a YouTube video in there. So here's another one. Would the vaccine damage our immune system, cause us to become more sensitive to mycotoxins? If so, would it affect the beta cells and T cells or other parts of the immune system more?
Absolutely. A long time ago, 25 years ago, I saw a lot of patients who had the hepatitis B vaccine. These were patients who were dentists, hygienists, EMTs, doctors, lab technicians who had to have the hepatitis B vaccine. They lined up and they had huge problems. Most of their problems were related to the brain and nervous system. In other words, neuropathies. And 2020, the program came to my center and filmed all this. The issue is that vaccines have an adjuvant effect. So yes, they're going to affect T cells and B cells. That's a given. And then they're also going to have they're supposed to have an effect on the immune system. But when you have a vaccine that takes 10 years to develop and you developed it in 2 years, obviously there's going to be some issues. Not everybody, but some people are going to have issues. That's just common sense. And that's why what we're seeing are problems with myocarditis, inflammatory myositis, all cutaneous lupus, and all these autoimmune issues, herpes virus reactivation, neurological effects, a lot of neurological effects. But that can also be added because of the mycotoxin issue that people, more and more medical centers are reporting because people stayed at home.
Okay. So would you say that the with people that had, you know, a reaction to the vaccine or vaccine injured, would it be that they had these mycotoxins already in their system and then this kind of would just push it over the edge? Or is there some sort of correlation between having this vaccine and injury with?
It's the scenarios, both possibilities. One is you were already affected, and so therefore it made it easier for you to have an adverse reaction, or you had it and shortly afterwards you had issues with molds and toxic molds and mycotoxins. But it's usually the first one. You were already affected, you didn't know it quite, you weren't feeling great, and then you had the vaccine or the infection or both, and it just pushed you over your immune system over the edge. Just to let you know, I'm a clinical immunologist and a toxicologist. I've got both. So this is awesome. Pretty common for me.
So, so then kind of a follow-up question for the one about the idiopathic peripheral neuropathy, saying, should he not bring up molds and itraconazole or other antifungals to his neurologist?
The neurologist is not going to understand unless he's read the studies, and most of them don't bother.
Right.
Go to their neurology conference once a year, and they're happy with that, and they don't discuss these things.
Okay.
You have to be on a different level of medicine to know about all these things, not your general everyday doctor, whether it's a neurologist, rheumatologist, or whatever.
Okay. Are there any substitutes for the itraconazole?
If it's very, very severe, you can use voriconazole.
And that's if there's some sort of conflicting.
No, it's just a stronger than itraconazole. Like, for instance, if you've also got osteomyelitis, infection of the bone, or your bone marrow is affected, etc., then you go to voriconazole instead of itraconazole. Itraconazole is the basic standard.
Okay.
No, and if you think that these supplements like oil of oregano and all these things, over 34 years I've been doing this, let me tell you, I've heard it all. I've had people taking shark cartilage and all kinds of things thinking that it's going to help them. It doesn't. They come to me after they've already tried all these supplement type medications. It doesn't work. Otherwise I wouldn't have seen this many patients.
All right. So then can you kind of describe what it does then that is different? I mean, maybe at the, I don't know, cellular level of why that or how or why this works the way it does?
Sure. But it's not, okay, mycotoxins being the same size as a COVID virus, 0.1 microns, does not work at the cellular level. It works at the molecular level. And because toxins are molecules, mercury is a molecule, arsenic is a molecule, glyphosate is a molecule, mycotoxins are also that. So therefore, at the molecular level, they get inside cells, dysregulate the mitochondria, and destroy the cell. and they start in the brain and basically the nervous system tissue and in the peripheral nervous system as well. And then they go from there, they go to every other part of the body. This is why they can cause cardiac problems, gastrointestinal problems, liver, kidney, etc.
Okay, cool. So there's a few other questions. What labs beyond Shoemaker and Mycolabs would indicate CIRS/mold toxicity for people with vaccine injury?
With vaccine injury, I usually recommend 2 tests. One is the breakdown of the COVID test, what it does to other cells, which I use immunoscience laboratories, and I do my Mycolabs mycotoxin test. I use these 2 tests. Don't go with this Shoemaker. It's a myth. It's not published stuff. It's just myth.
Right. Okay. Another question: can vaccine injured who have probably mycotoxin illness take light binders while in mold-like modified citrus pectin? I'm not sure.
Well, as I mentioned before, there is one published study on binders in humans, and it says it doesn't work. Okay, it does work in sheep, rabbits, rats, piglets, fryer chickens, not humans.
Okay. What could taking the itraconazole, with the vaccine injured, reverse any damage or repair any damage that has happened?
Well, I just showed you a bunch of studies, published studies that says yes.
Okay. All right. Here's another one. How often do you see mycotoxin illness being the root cause of things like MCAS or ME/CFS?
What is ME/CFS? Chronic fatigue syndrome. What's the top 5 symptoms of toxic mold mycotoxin effects? Fatigue, brain fog, joint and muscle aches and pains, GI problems, sleep disturbance. So these studies that I just showed, they said the ME/CFS is caused by mycotoxins. They proved it.
Awesome. All right, we got some good stuff. Any more questions? I got one here. It says, can mycotoxins cause benign nerve tumors?
Yes. Now, that was published in 93. They're called neuromas.
So there's a lot of good information. You have a lot of good studies. How come it's so hard for, I feel like, other doctors to know these things?
Well, it's not hard. The problem is that doctors don't take the time now. I speak to doctors every day because everyone I'm the medical advisor for my Mycolab. I don't get paid by them because I couldn't teach at a faculty if I were receiving income from any commercial program. So I do it for free. And every person who gets tested gets a Zoom call with me to go over their tests. So I talk to doctors all over the United States and all over the planet. And these are doctors, and they say, I don't have time to read, but I can listen in my car. And okay, that's great that they listen and they can listen to my webinars. But it's very hard for doctors to read because most healthcare is insurance driven. You have to go by what the insurance companies say.
Right.
What they allow, let me put it that way, what they allow.
Right.
So it's not like a doctor is an independent person. No, he works for either a hospital group or another group, and they have all the same software, and they're staring at their screen. They're not looking at you. They're looking at the screen and tapping away.
Yeah. So we got a few other questions here. I think they might have touched on them. What was the other test that you mentioned other than the Myco lab? Myco lab?
It's my Myco Lab, MYCOLAB, and the other is Immunosciences Lab.
Immunosciences lab.
That's run by Dr. Rajdani. He and I have published many studies together, and I have published on my end with other doctors, and he has published on his end with other doctors. But we all looked at all these vaccine issues. We all looked at all these mold mycotoxin issues, the issues with COVID, SARS-CoV-2, etc. I shorten it to COVID for you, but when I talk to colleagues, it's SARS-CoV-2.
Right. Okay. And I had another question, but I forgot it. But here's some other ones anyway. So the question is, how can we get a doctor to prescribe this for us?
First of all, you have to know if you have something that needs the prescription. You don't get a prescription, oh, I'm going to see if it works or not.
Right.
That's not.
So basically, this individual would have to go through, reach out to you.
I'm here to help people. Look at the color of my hair. Okay, I'm not here. I've done my thing. I keep publishing and teaching, etc., to help others. So I want to teach others, and I'm happy to answer any emails and give guidance because there's so much misguidance on the internet. Unfortunately,
Yeah.
it's all about money. They're all trying to sell you something. I have my internet site. It's andrewcampbellmd.com. I'm not selling. I don't have anything to sell. Oh, this week, 20% off this supplement that's going to make you whatever. I don't do that.
Good, good. So yeah, so I guess the question is how do we get a hold of this stuff? The testing and then the stuff.
Shoot me an email.
All right. Yeah, that's probably the best way to do it. Here's another question. Have you seen limbic system retraining help patients with mycotoxin illness?
No, it doesn't. You have to get rid of the toxin. Once you get rid of once you get rid of the cause, guess what happens? You get better. You get well again. I mean, frankly, that's what the car mechanic does. Figures out what's wrong, takes it out, replaces it, fixes the damage, and you're on your way.
All right. Here's another question. It said the OAT test, this individual says the OAT test was essential in understanding the complexity of what was happening in my body. It helped to lay out the map of how to start chipping away at the issues. Can you compare and contrast the solution you're talking about?
Well, the OAT cell is basically a non, there's no studies that show it does anything. It's just, they developed that test and fooled everybody into trying it and paying money for it. What you need to do, the easiest thing to do is go to the My Mycolab channel on YouTube and watch 4 or 5 videos of my webinars. And you'll understand it more because it's hard to explain something like that important in just a few moments.
Okay. So there are other questions popping up, and I sense the theme here is like this itraconazole, sounds like good stuff. And you mentioned test first and then look at getting that. But is this something is this drug something that's accessible? Would doctors prescribe it?
Yes. I
Okay,
mean, you saw the picture of the cancer guy,
right.
big thing on his forehead. 2 months later, tumor is gone.
So it's a matter of doing the correct test, showing that you need the stuff,
Yeah.
and then getting prescribed the drug.
Okay. You go see a doctor and say, I want iron shots because I'm anemic. He's not going to do a thing for you until he tests you for anemia.
Yeah. Okay, so we look at getting some tests done from the doctor, talking about your symptoms, getting those tests done, and then you can get prescribed the drug.
Correct. You don't go to a doctor and say, give me an antibiotic. I have an infection. He's going to say, well, what infection do you have? Where? Oh, I think I have a bladder infection. Oh, well, pee in a cup and let me look at it under the microscope. He's not going to just say, oh, you have an infection. Here's an antibiotic. Go forth and multiply.
Right. Okay, here's another question. Is it expected that my mycotoxin levels will decrease with treatment, or are symptoms a better goalpost of progress?
Mycotoxins are toxins. Therefore, they will decrease, and then you test again in the future, and you will see that the mycotoxins are back to zero. Toxins, you don't want any amount. Don't ever ask someone, how much mercury is it okay to have? You don't want any. You don't want any of these toxins in your body. Is a little bit okay? No.
I like this. This is good. All right. Are there any other questions? We've been at this for almost an hour now. We got a lot of good questions. Is there any others that anyone has? Here's one. Can you heal while still in a moldy house?
Can you what?
Can you heal? Can you take this drug and be healing, getting these out while still living in a moldy house?
Okay, say you work in a lab and you're breathing mercury fumes and you're detoxing for mercury. Is it going to work? No.
No.
It's a gerbil in one of those circles going around and around.
Yeah. So get out of the toxic environment and then clear your body of any of the toxins.
Basically 5 steps. And the first one is the hardest. It's the first rule of toxicology. Get the patient away from the toxin or the toxin away from the patient. Second, itraconazole. Third, nutrition. You can't be eating Pringles and drinking Cokes in front of the TV every night.
Because it's pouring more toxins in your body?
Correct. So you need to be aware, and there's a whole thing I do about nutrition. 4, you've got to take certain specific nutraceutical supplements. There's only 6 to help build the immune system back up.
Yeah.
And then 7, repeat the test when you're well again. I've treated over 17,000 patients with problems like this, from molds, mycotoxins, vaccines, chronic disorders, etc. You know, and plus I've published 100 studies on this, over 100 studies. I have chapters in medical textbooks, and I teach faculty at medical schools.
So in this time period, have you seen an increase in people reaching out because of mycotoxin issues with vaccine rollouts and things?
Yeah, as I showed in the beginning, we're having a real issue with climate change. So there's all over the planet. I mean, I do Zooms with doctors in Crete, Dubai, Cambodia, New Zealand, Australia, Mexico, Brazil. The world is having issues. You know, it's not like it's isolated.
Yeah, yeah. Here's another question. How do we differentiate what neurological damage is from the vaccines versus mold or Lyme?
There's tests for that.
Is
There's
there
very, very specific tests, and you've got to know the laboratory. Let me explain it to you. There's labs out there who have tests that are totally not valid. The urine test, for example, that's invalid. There's tests for Lyme that are not valid. You know, so you got to go to the best. But for example, Lyme test, the only lab that has a patented Lyme test is Immunosciences. The rest are not acceptable tests in medicine. And then people get treatment for Lyme for years. It's been shown and proven time and time again that that doesn't help. I saw a young girl, 21. Her parents brought her to me. He was a very important person on the planet. And she had, when she was 17, she went to somewhere and got bitten by a tick. And she went to this really big Lyme guy in New York City, Manhattan. And he started treating her. And after 6 months of treatment with multiple antibiotics, guess what happens to the gut when you take that many and your microbiome? 80% of your immune system's in your gut. You destroy all that. Well, anyway, then he put her on an IV. She was a very smart girl going to a very good school, and she got into Harvard. She dropped out her first semester because she couldn't handle it. More antibiotics and more rounds of multiple antibiotics. Finally, the parents brought her to me. I did the mycotoxin test. It lit up like a Christmas tree. Within 2 months, she was super much better. Mom and dad started calling me Dr. House.
That's awesome.
And I have many stories like that.
That is awesome. All right. Let me see if there's any other questions. Here's one. Will you get worse before getting better after starting the itracizole?
About 1% have a Herxheimer reaction, which the other side of that coin, 99% are fine.
So another question comes to my mind. So when you're doing this, is it different length of time of taking this drug depending on, whatever you're suffering from? Or is there kind of like a basic timeline you take the drug and then check again?
Every person's immune system is unique and different, like a fingerprint. If you had a monozygotic twin, which means a twin brother from the same egg from your mom, you'd have different immune systems. Okay. Having said that, because everybody's different, you have to adjust the treatment. It's like my shirt may not fit you and yours may not fit me. So you've got to have a bit of that. And that comes out in the question and answer part of the initial evaluation.
Okay. Here's another question. Does IgA deficiency change treatment?
Does what?
IgA deficiency?
No. 20% of the population of the general population has IgA deficiency. It's not dependent on that.
Okay. Here's another one. Do you find candida issues to be associated with mycotoxin illnesses?
Okay, candida is a single cell mold. Okay. multiple cell molds are Aspergillus, Penicillium, Stachybotrys, Fusarium, Cladosporium, all the others. All yeasts are single cell. Yeasts are what we use to make bread, alcoholic beverages, etc., and Candida is one of them. These others are what cause the problems, the multicell.
Okay. So kind of following up that question, are there specific foods to avoid with mold toxicity? It says, for example, aflatoxins in corn.
Aflatoxin is not found. There's many studies that show that it's not found in indoor air. It's found on things that are outdoors, certain plants, leaves, bushes, things like that. It's not one that we get unless you get exposed, and there are certain countries that they're common in. The basic areas that they're more common in is Western China in their rice because of the method they store the rice, and in certain African countries which lack oversight of how they store grains. But if you're talking about the United States and other countries, it's not an issue. Aflatoxins are not an issue.
So what, following that up, what foods do you recommend? Because you mentioned the test and the drug, and then nutrition. What nutrition, kind of in a nutshell, would you recommend?
Yes, because that's a 45-minute lecture.
Yeah.
Very, very, very basically, eat organic, no gluten, no sugar.
Yep. That's good. Another question. Have you seen patients who became wheelchair bound from mold issues?
Oh yeah, causes mycotoxins, and I showed the slide. Gliotoxin causes MS.
Mm-hmm.
So I've seen 20-some-odd-year-olds show up and they come see me in a wheelchair. I have pictures of this. I couldn't show everything on this short,
Right.
But they come in wheelchairs, and then 6 months later, they're fine. They're walking.
Yeah,
Don't need a wheelchair or anything.
It's amazing.
I've been doing this for a long time. It's not like just recent.
Right. So here's another question that's been asked a couple times here. Is there a guide with finding the best place of real estate to leave a mold infested home? I don't know if there would be, but probably dry climates would probably be the best place to go.
Excuse me. I have patients in Dubai. It's the desert. How dry do you want to get?
That's true.
All over Arizona.
That's true.
Phoenix, Scottsdale, all those places. It's the indoor. It's not the climate. It's things like today. Okay, people have a house. They've got 2 or 3 bathrooms, or 2 or 3 bathrooms and a half bath. They've got a refrigerator that spits out ice and ice cold water. They've got a dishwasher. They've got a washer and dryer inside the home. All those are potential leaks, and it doesn't have to be a big leak. It can be a drop a minute, just a tiny little drop. When was the last time you pulled your refrigerator out from behind the wall and checked? Never. I don't do that. When was the last time you pulled out your washer and dryer and checked? When was the last time you pulled out your dishwasher? So these are all, and then all these bathrooms. What happens behind those tiles or underneath them? Those are all things, potential places, not the climate outside.
So then, do you see reoccurrence of these people? They do protocol, they're very successful, but then their home environment is such that, like you mentioned, fridge, dishwasher, all those things, those common things that we live with. Do you see people regress and have to redo treatment again?
No, because unless they're living in a place with no more mold, you don't start treatment. It's absolutely waste of money to start treatment while you're still being exposed daily. Let's say it's in your ventilation ducts, and there's a mold the size of a golf ball. Those spores, every time it turns on, you're breathing those spores day in, day out. You're sleeping, breathing those spores. Well, so what's the use of getting treatment if you're being constantly exposed again?
Mhm. So how do those people not relapse if they go back into an area where that's producing mold?
They get it remediated.
Okay. All right, I'm just looking at other, we might have wrap this up here. We're gonna have one more question. Is it true that mold issues, well, I think it kind of showed this in the video, but weren't as prevalent years ago because of different building materials, things like drywall and sheetrock being commonly used today?
Yeah, drywall is like presenting a mold with a banana split ice cream with a cherry on top. That is, before we used to use plaster. Plaster is alkaline. Nothing grows on plaster. And what did grandma do? She opened her windows. Anything that flew in flew right back out again. Okay? Then had plaster. Now we use drywall. I've watched apartment buildings go up in 6 months in the rainy season.
Yep. Yep. Well, all right. We could take one more quick question. Anybody? There's a lot of good information out there. So I just want to thank Dr. Campbell for coming on and sharing this information with us. I think this is a very good topic and a lot of good interest. So hopefully you see a lot of people reaching out to your email and things like that. But
by the way, if you want the vaccine article or any other articles, just send me an email. I'll send it to you. Don't pay for it on PubMed or one of those other things.
Awesome. Thank you so much. All right, everyone. Again, thank you, Dr. Campbell. Thank you, everyone, for joining, and we will see you on our next webinar.
All righty. Good night, everybody. Bye-bye.